Brian Mudd Show is on News Radio 610 WIOD.
Another big story out there. You've got the J&J vaccine paused, and it's stoking some hesitancy that threatens COVID-19 vaccination drives. I want to go to Dr. Fahmi Farah right now, who can explain more of what's going on here. Doctor, thanks for being on the show.
Hi, thank you for having me.
All right, so this pause in the vaccine, should people be alarmed, or is this somewhat normal?
As you know, with the Johnson & Johnson vaccine, we had some people who had side effects with like blood clots and things like that, and it caused somewhat of panic at a population level, and that's why CDC had decided to put a pause on it and just to take the safety precautions and to give everybody more reassurance, and that's exactly what they have done. The reason for the pause was not to alarm people, but rather to take the moment to do more safety protocol, to take more precautions to see if it really is causing the amount of side effects that people are thinking it's causing. And then it was cleared. The reason it was cleared is because it's actually not. It's safe. And so I really, my thought is that no, it should not be causing as much alarm as it has. That, the reason for the pause was for safety reasons, and they have cleared. It is a safe vaccine to take.
Okay. I want you to tell me, or I want you to give me your opinion on me, because I have people asking me all the time if I'm going to get vaccinated. My answer is no. And it's not because I fear the vaccine. It's because I'm healthy. I take care of myself. I work out every day, and I've got a great immune system. Should I still get vaccinated, in your opinion?
Yes, that is my opinion. And the reason being is because, this virus is affecting many, many healthy people who have great immune health, people who are taking care of themselves like yourself, working out, not many comorbidities. And with the different variants coming out, it's affecting even the young population. As you've heard in the news, in India, what's happening, it's a brand new variant in India, and it's affecting a lot of young people who are healthy. It's even causing a lot of young people to die. So for those reasons, I do think that the vaccine is recommended for everyone who can take it, especially those who are rather healthy.
Can we compare India and kids in India to American kids? I mean, I would have to think that American kids are healthier. They've probably been vaccinated, with vaccinations that are mandated that you get when you're a small child. I mean, comparing kids in India to kids in America seems like apples and oranges to me.
You're right. It's not necessarily that we're comparing Indian kids to American kids. They're in two different geographical locations, two different backgrounds. And you're right, from an immune health standpoint and health standpoint, we are more advanced in terms of what we have access to for our children here. But that being said, even here in the U.S., even if you take India out of the question, we have seen, the mass number of people, like millions of people getting infected. We have seen young people, even athletes, people who are very healthy otherwise. When we think of athletes, we think of they're the example of health because they're working out, their routine is very good. They take care of themselves. And we have seen many athletes get affected by COVID-19 throughout this pandemic. We've even seen some who have died from this. So it's not just a comparison thing between India versus America or any other country. It's really even what we've seen here in our country. It really is safe, the vaccine. I myself have taken it. Thousands of people have taken it. And the data so far is very good. And now we have more data, over the course of the last several months that we've been inoculating people. We have great data that it is safe. And it's actually preventing people from getting infected, and great data on people who are even getting infected despite getting the vaccine, that they are not getting as sick. Their hospitalization rate is far less. And so those are great data and statistics to go by.
Doctor, I'm not trying to be difficult. I'm just trying to get to the root of different issues here. We always hear, listen to the science. The science is telling us right now that hospitalizations are down, infections are down, deaths are down. The science tells us that the flu is more worrisome to kids than COVID. We know that this thing has a 99% survivability rate. We know that we have better treatments now. I just don't feel the need to get vaccinated. I trust my own immune system. I mean, I still cannot, even with what you said, you're not convincing me that this is something that I need.
Well, at an individual level, that is a choice you can make. But as a person from the medical community and a person of science, my recommendation would be at community at large. All the listeners, I encourage them to take the vaccine. All those who can and those who do not have any contraindications to the vaccine, I absolutely urge them to get this, because this virus is going to continue to claim more lives in ways that have already been very unimaginable to many of us. Being in the front line, the way we have had to fight, and we continue to fight against this virus. The only real hope we have to coming out of this dark days, this pandemic, is truly the vaccine. It's the only true tool we have to prevention, and prevention is key when it comes to something like this. It's true we do have a few more treatments now, but none of this is proven. None of it is truly effective, and that's why we continue to lose people, not just here in the United States, but worldwide. Right.
Yeah, I do respect your opinion, but let me ask you this. I mean, if I've already had it, getting it again is extremely rare. Like, so extreme, it's not even worth talking about. So again, I know I've already had it. Why should I get vaccinated?
Well, so I actually disagree with that, because it's not true that if you get it once, that it's extremely rare. We're seeing many people who have gotten it, and then within 3 months they got reinfected again. I've had a large population of patients who've been reinfected twice. So it is not at all rare to get the vaccine twice.
Yeah, everything that I've researched on that says it's extremely rare. That's from the CDC.
Yeah, it's not to say that it's very common, but it's not to say that it's impossible. And we are seeing every day in the medical community people who have been reinfected. In many instances, people who have been reinfected with this, they were sicker the second time. The first time some of them required hospitalization, but they left fine. And then the second time, they were intubated on the ventilator in the ICU. So this is a totally different virus that we're dealing with. We've never had to deal with anything like this. And the alarm is definitely up there. We are nowhere close to being out of this pandemic. And my message, my recommendation as a doctor, as a cardiologist, as a person from the medical community fighting in the front line, is to take the vaccine. This is not just to help yourself, but to help the community. To be able to achieve that herd immunity, we need to have more and more people getting vaccinated. We live in such a global community now. It's not to say that just because we're doing a better job with vaccination or our numbers are reducing at the moment doesn't mean that we're not going to have another wave. And what I mean by global community is that, whenever we're seeing variants elsewhere, they're making it here. The coronavirus, to begin with, it came to us, how long did it take? Not very long, right? And it affected millions. We've lost more than 500,000 people. This is like a war we're fighting. This is like a world war almost, right? We've lost more people than we did in World War II even.
But we got to remind ourselves, Doctor, that we've lost elderly and sick people. I mean, I would love to know the percentages on healthy people. The science says this does not affect healthy people in an overwhelming way. It was the sick and the elderly. Most of these deaths were in nursing homes. I mean, that's the facts.
Well, the facts are that you're right. It has affected more elderly people who have more comorbidities. But the fact also is that it's affecting everybody. I mean, there are young people who are in the ventilator as we speak right now in this country. The fact is that, it's the young, healthy people who are asymptomatic were the highest spreaders to the elderly. So those are facts. Just because the young people may not be affected as badly as the elderly doesn't mean they're not part of the problem, that they're not contributing. They absolutely are. It's the asymptomatic spreaders why we're we've faced a lot of the numbers that we have. A lot of the elderly are affected because of the asymptomatic spreaders.
All right, Doctor, I appreciate
absolutely have to take the precaution.
Appreciate your time. I got to get going. Thank you.